Well, yesterday we said goodbye to the month of February, which is also Nationally Healthy Heart Month. And while it puts a tremendous emphasis on cardiac care, the truth is preventing a heart attack is a year-round commitment. And joining us this morning is Sharon Gauthier. She's a nurse and the founder of Patient Advocate for You. Sharon, good morning. Thanks for being here.
Thank you.
All right. So the first thing, we hear so often about heart disease. People talk about it a lot. What are the latest statistics?
Well, I think statistically, women are having more heart attacks than men now.
Wow.
And the symptoms that women have and men have are different.
So and is that something that more recently in the last few years, women kind of having it more than men?
No, I think that's always been the case. I think women have always just been looked at as being more emotional if they showed up in the emergency department, which is most of my background, working in the emergency department, with symptoms at the time that weren't traditional for a heart attack. People think of that crushing chest pain that radiates down your arm, and that's not always the case. So a lot of education has gone on and a lot of research on women tend to have symptoms that are different. It may be some gentle jaw pain, it may be neck pain, not at all what you would think is a heart attack.
Exactly, and that brings me to the next question. What are some of the symptoms of a heart attack? I mean, we hear them often, but they bear repeating because, as you can probably attest to, people sometimes ignore them.
Correct. So interesting that I had an interview last week with a gentleman in Waterbury or Willimantic, and he was telling me how when he started walking up the stairs, he really wasn't getting chest pain. It was a little bit of discomfort. Now, if you have some discomfort in the chest area, you tend to think maybe it's indigestion. But if it's consistent and initiated by exercise, it may not necessarily be. Although he wasn't having a heart attack, he was smart enough to go to his doctor. And in reviewing and doing some tests, they found that he had 90% blockage in one of his arteries. And then was scheduled actually to have an angioplasty, an angiogram. And in between that was well educated by his physician what to look for. Had similar symptoms, but a little more aggressive, and went right to the hospital and then had that procedure that day.
So that's a case where if he didn't go to the doctor, he very well could have died from a massive heart attack.
Absolutely.
So what are some of the main symptoms? I mean, we often hear about numbness on the left side, tingling. What are some of the things people should be looking for?
Well, I think you should be looking for anything that's different, and especially if it's initiated by exercise. So if you're going up the stairs and you feel a little discomfort, not necessarily pain, in your jaw, in your arm, in your chest, in your neck area, then I would certainly take heed to that.
Your body's almost giving you some sort of warning that you need to listen to.
Absolutely.
All right, so what can people do to prevent heart disease? The big question.
Well, of course, it always goes back to diet. I also think that it is always good to have a yearly physical. I last year, with no history of hypertension, but have it in my family, recently lost over 100 pounds in the last 5 years, so in a much better healthy condition. Went for my regular checkup with the doctor. She took my blood pressure and it was 200 over 108. She immediately wanted to send me to the ER, and of course, being a nurse, I said no. I would monitor myself, but it was a heads up on how important it is to keep those yearly physicals, because when they call it the silent killer, that's exactly what it is.
Exactly.
And then initiated on medication, followed up with a cardiologist, and became proactive in getting a stress test and blood work done. I don't have high cholesterol, but I now have hypertension.
So pay attention to your body and get those checkups. That is certainly key. Now, how do you help patients and families with care if they are admitted to the hospital after they've had a heart attack?
Well, sometimes we're called during that time. So our particular nursing practice that I started about 8 years ago is wrapped around coordination of care and crisis intervention. So we've become well known in the community, and oftentimes we will get a call from people when they're hospitalized. We got a call from a gentleman who had actually had a heart attack. He had bypass surgery, but he was really concerned that they weren't managing his diabetes well. So again, education, asking the questions. His questions were, they can't tell me how many grams of food I'm eating or carbs I'm eating, because the way the hospital was doing it was different than his. So it was just going in and assisting them and getting the nutritionists up to having to explain how he could monitor his diet better in his way.
And that's where you go in and you help them.
Yes.
Because obviously there's a lot of questions. And speaking of which, what do you do after the patient is discharged? I imagine it's somewhat of what you just said, going in there and sort of helping them adapt to everything.
Correct. So initially, if we're involved in a crisis, the families will hang on to us afterwards to just coordinate care out in the community. We don't replace the VNA. There's wonderful visiting nurses organizations out there that do all the hands-on. But the nurses that I have are 20 years experience, and we coordinate care. So we know how to navigate the system well. So we'll follow them home, make sure they understand their medications. It's just an extension of the education that's provided in the hospital.
Because it's a life-changing experience when someone goes through an ordeal like this. And obviously, too, you can speak to this. People, what they do earlier on in life with their bodies often will impact them later in life. So people, even young people, should be thinking of their heart and the decisions they make in life, because it could rear its ugly head later on.
Correct, and I think now pediatricians in the last 10 years are now taking blood pressures of young children that are coming in. I talk to my daughter all the time about the diets of my grandchildren. My kids lived on McDonald's and macaroni and cheese, and no one ever thought anything about it, but through the years we've educated ourselves now to make better choices and read labels, even at a young age.
Eve, that's very important. All right, a lot of great information. Sharon, thank you so much. We
You're
greatly
welcome.
appreciate it. And if you would like more information on anything we just discussed, just go to WTNH.com, click the On Air tab, and pull down to the Good Morning Connecticut weekend section.